MSK Ultrasound versus MRI, which one is actually better? Doctors love to debate this ultrasound versus MRI as if you're supposed to pick a side, okay? But here's the truth that nobody says clearly enough, and that they're not competitors. They're actually complementary to each other. And when you understand what each one does best, your diagnostic accuracy will skyrocket. So let's break it down, okay? Ultrasound shines when you need clarity, speed, and real-time decision-making. It's the tool that allows you to diagnose and treat in the same visit for things that make sense, right? So ultrasound is superior for tendons, okay? So in evaluating a tendon, the tendon health, right? Achilles, patellar tendon, proximal hamstring, ligaments such as ATFL, the ulnar collateral ligament, the MCL of the knee, dynamic impingement testing, subluxation, dislocations in real time of the long head biceps, and countless others, right? You can actually press, move, and load things and watch the pathology respond. Ultrasound is the only modality that lets you say, show me where it hurts, now let's watch what happens when you move, okay? MRI can't do that. X-ray can't do that. CT definitely can't do that, okay? So now with MRI, where is it better? When is it better? Okay, MRI wins when you need depth, detail, or surgical planning, or some combination of that. MRI is superior for deep structures such as hip labrum, deep gluteal space, the spine. We're evaluating bone marrow edema, stress reactions, occult fractures, labral pathologies in the shoulder or hip, preoperative planning, mapping out complex surgical anatomy. MRI gives you the big picture. Ultrasound gives you the real-time picture. And in regenerative medicine, you need both. Okay? The real problem is thinking that you have to choose. Too many clinicians treat ultrasound and MRI like rival technologies. They're not rivals, they're teammates. MRI gives you the macro, ultrasound gives you the micro view. MRI shows you the architecture, ultrasound shows you the behavior. MRI tells you what exists, ultrasound tells you what it does. So when you combine them, okay, you get a level of diagnostic clarity that no single modality can match. So why ultrasound is the first line choice in most ortho and sports injuries offices is that for the majority of musculoskeletal pain complaints, ultrasound is the most logical starting point because it's really fast. There's no scheduling, no waiting. It's accurate, especially for tendons, ligaments, and superficial structures. Is dynamic capacity. You can test the movement, load, and function. And it's immediately actionable. You can diagnose and treat in the same visit. As well as it's cost effective, right? MRI is powerful, but it's not always necessary first. Ultrasound lets you answer the question today, not weeks from now. Okay, the bottom line is ultrasound and MRI aren't competing. They're complementary. And doctors, and the best doctors know when exactly to use each one. Ultrasound when you need the speed, clarity, and real-time insight. And MRI when you need the depth, complexity, and possibly surgical planning. And so when you understand both tools, and when you deploy them, your diagnostic accuracy, your efficiency, and your patient outcomes, they all go up. So that's the power of using the right modality at the right time.